Welcome to today's podcast. Today we're diving into the challenges of managing asthma with controller medications. Let's get started.
Yeah, asthma management is such a crucial topic. So what's the main issue we're looking at?
Well, it's really surprising. Only about 35% of asthma patients are actually using long-term controller medications,
Really?
even though they're essential for preventing exacerbations.
That's concerning. Why aren't more patients using them?
There are several reasons. Lack of healthcare access, insufficient education, medication side effects,
Right.
poor provider management, and lack of patient follow-up.
But don't you think that patients also have a responsibility to manage their health?
Yes, absolutely, but it's a two-way street. Providers need to ensure patients are educated and have access to resources.
Fair point. So all these factors contribute to the problem.
Exactly. And it's leading to a lot of asthma exacerbations, about 1.8 million emergency room visits each year.
That's a staggering number. So what can we do to improve the situation?
Increasing the use of long-term controller medications is key. Practitioners need to be more familiar with these medications and the stepwise approach to asthma management.
The stepwise approach? Can you remind me what that involves?
Sure, it's like adjusting treatment based on the patient's current asthma control using specific guidelines.
Got it. So what types of long-term controller medications are available?
Well, first, we have inhaled corticosteroids. They're the mainstay treatment. They reduce inflammation in the airways.
Right? And they're effective across all age groups?
Yes, exactly. Then there are leukotriene receptor antagonists, which block chemicals that cause airway swelling.
And those are taken orally, right?
Yeah, they're pills, which can be easier for some patients to take consistently.
What about long-acting beta-2 agonists?
LABAs relax the smooth muscles around the airways, but they should never be used alone. They must be combined with an inhaled corticosteroid.
Because of the increased risk of severe asthma attacks if used solo?
Exactly. There's even a black box warning about that.
Do you think all practitioners are aware of these risks?
I think some might not be fully up to date, which can impact patient care.
But isn't it also up to the patients to stay informed?
True, but healthcare providers have a responsibility to educate their patients.
That's fair. So what else can improve asthma management?
Patient education is crucial. Teaching them how to use an asthma action plan, perform peak flow measurements, and recognize worsening symptoms.
Speaking of peak flow meters, do patients actually use them?
Well, only about 19% of asthma patients have a peak flow meter at home, which is really low.
That's surprising. Maybe we need to stress their importance more during consultations.
Definitely. Regular follow-ups and recommending vaccines like the flu shot and pneumococcal vaccine also play a role in better asthma management.
You know, sometimes I feel like we focus too much on medications and not enough on the bigger picture.
That's a good point. Managing asthma is about more than just prescriptions. It's about comprehensive care.
Exactly. Putting all the pieces together is essential.
Yeah, when we do that, we can truly provide exceptional care for our patients.